we have a tiny bit that is 85253, which is Paradise Valley. That I assume is in northeast Maricopa.
Right.
Or North Phoenix.
Yes, your boundaries go into 85018, 85008, 85016, and 85006. And all those are in Central Phoenix. There's only one school that you have in Paradise Valley, and that would belong to North Phoenix.
Okay. Thank you. I
Thanks,
guess
Susan.
the last question I have is for Dr. Boyle. I think that for something like this to work most effectively, the relationships that need to exist are between the school district and to make sure that so we can partner and say this is what we need our kids to be doing at kindergarten from day one. I'd say more in your realm than our realm. So I'm wondering, do we already have relationships and conversations with First Things First?
Formally, no,
Okay.
but
Informally,
informally, yes.
okay. Great. Well,
I
thank you.
have been in communication with your liaisons. I've met with Maria before she left, and I was able to talk with all of them. They received my communications. I sent them our newsletter, and but definitely it's not enough.
Yeah.
We need to participate in a more coordinated way, as you're saying. That would be really very helpful for us to understand your needs and to try to participate in a better way with you.
Yeah.
So-
I think that Steve Mittenfall refers to that as the bookends. If we can strengthen that end, that would be terrific.
Yes.
Yeah, Tiffany?
Are you involved in the health fair that's coming up at Excellencia?
No, we are not, but I do know about the health fair. And this is a great example of how we can participate. Because if I had a better understanding on what's going to happen, how many people are going to be there, I would reach out to some of our grantees, some of the programs and services that are serving in this area, or maybe that they're not serving in this area, not necessarily, but that they're helpful for your community of parents, and set a booth with them. Just first things first, we are not first-hand or direct service providers. So the parents get anxious. They really want something that they can touch, they can go, they can call. And included in your package, you also have a resource guide of the services in your region that they can call and they will get information about it. There are several others, like Quality First, for example, that the parent probably can't call directly. It will be through other channels that they can. But those are a very good example. We have those in English and also in Spanish, and that would be a very good coordination if we would know about it, and we can coordinate with another grantee that can bring services to the parents or information. Our main goal is to raise awareness about the importance of early childhood development.
Absolutely. What is your partnership with the Phoenix Children's Hospital, which is also in our district?
It is very close. We have injury prevention programs there and Care Connect that will do some kind of enrollment to the insurance, help them in case that they have specific problems, that they need a home doctor, and it helps them coordinate because the medical family is really very difficult for the parents to understand. And when they have a kid that has more than one problem, it's not easy to connect all those services and doctors for them. So they do that. So we're really very close to them.
Thank you.
First of all, thank you for being here. Secondly, for disclosure purposes, my position at Children's Action Alliance is funded in my day job in part by First Things First, but not by the Central Phoenix Regional Council through North Phoenix and Southeast Maricopa. We have a grant to do the health insurance outreach and enrollment in those regions. So just so board members know that that is something in those districts where we do work very closely with schools. And in the past, Children's Action Alliance, prior to First Things First, had funding from another funding source in which we did work with. When Kids Care was still open to enrollment, we, and Dr. Boyle is nodding because she remembers this, we had a health fair at our community education center, 24th Street and McDowell on the Excelencia campus. And Access was very, very cooperative at that time. And we, they were eager to enroll kids in a way that they are not able to now. Due to funding, and they were, we did a data match between kids who were in Kids Care and kids who were enrolled in our free and reduced lunch program, because nearly every student who's in our free and reduced lunch program would qualify for Kids Care or Access Medicaid. And so we took our information, the data match was done, and there was I think a letter that went out to all the families inviting them to a health fair. And I was there, and we had clowns, and we had entertainment for the kids and balloons, and then the parents went inside and signed up and got their kids' health insurance. So that's kind of more along the lines of what something very similar to what kind of things would be with health insurance. It would be what we do in North Phoenix and Southeast Maricopa is help families apply through the electronic application to access. If they're already in Kids Care, although enrollment's closed right now, we can help them stay in Kids Care by re-enrolling every year, which they have to do. And if they don't qualify for those, we have other resources such as community health centers and other places with sliding fee scale where parents can get health care. So that's very important. Also schools have been not just partners with grantees, but they have been grantees themselves. Is that correct? I don't know about Central Phoenix, but in other regions.
Absolutely. I know in North Phoenix, the schools work with family resource centers. There are several family resource centers that are set up in the schools, and that's working out really very well. So, and there's a good deal of partnerships with libraries for the literacy programs.
And I know that the Washington Elementary School District has a grant from North Phoenix to have a community resource center. I thought that there was an RFGA released in Central Phoenix for a community center, and I can't recall if that was...
You know, I think that what you're probably referring to is the family support coordination, and it's very similar. We're actually pulling together and working with collaboratively and trying to work with coordination across Maricopa County with all of the family resource centers. There's 22 that are funded through First Things First. So it only makes sense. It's such a very strong base for family support. And with this new strategy that we have, we will include the family support coordination folks into that. So that's maybe what you were thinking.
Okay. What I would encourage our district to do is, first of all, to learn about the strategies and see if there's anything that we as a district should be in contact with the grantees, or where we should be looking at pursuing grants ourselves, given that we have a community education program here. And with that, also to make sure that somebody at a relatively high level is subscribed to the emails that do come out when those RFGAs are released, because we can be notified when there are grant opportunities and using First Things First as funding. The final question I have, I guess those are all comments, but the question that I have is Quality First. Is this something that is a national program? Where did this come from?
Quality First stemmed from actually Smart Start in North Carolina, and it was, I'm not going to be able to cite the number of years that it has been in North Carolina, but it has been a highly successful model. Very similar to the First Things First model and California's First Five. And the Quality First program is modeled on a very similar program in North Carolina. And they are far advanced at this point, and they have seen a significant change in the quality of the child care centers and programs over the course of years through the STAR the rating system, and so we know it works.
And we know that 90% of a child's brain is developed by the time they're age 3. And so what we as an elementary school district receive children at age 5, their brains are pretty much developed at that point, all of the neurons and the connections. And moreover, I know I had read something several years ago looking at the children of higher education versus lower education parents, and those children who have parents who have graduate degrees are exposed to 3 times as many words at the time they enter kindergarten compared to those whose parents were presumably high school dropouts or just a high school degree. And so we start off with a tremendous achievement gap as a school district when we get students who are 5 years old. And now with Move On When Reading, we are expected to eliminate that achievement gap more or less by the time that those students are in 3rd grade and get all students reading. And I think that's a very difficult task. It's like trying to come back from a 4-touchdown deficit in the 4th quarter. And have that kind of pressure on us. I think we really have to be working, again, with the bookend strategy and looking at when children's brains are developing. So, thank you.
Well, we're there to help you and work with you, and we're encouraged by that partnership. I will just say, in relationship to the RFGAs that are going to be released, if you do go to the website, you can sign up for the listserv, so you can be alerted when there will be more than 70 RFGAs statewide going out.
Thank you so much, Ms. Tolles Johnson and Ms. Ibarra.
Thank you very much.
Next item on our agenda is discussion, conference report on the